Well, hey everyone, welcome to Leading Rural Healthcare, where we're having conversations beyond the margin. Every other week, we bring you real rural healthcare leaders with real challenges, making real impact in their communities. I'm your host, Brendan Hurley, and I'm excited to have a conversation with Matt Fry, who's the president and CEO of Freeman Health System in Joplin, which is a locally owned nonprofit health system serving communities across Southwest Missouri, Southeast Kansas, Northeast Oklahoma, Northwest Arkansas, and now even some new territories within the confines of 2026. So, with four hospitals, four more to go, and over 90 specialty services, and what is it, Matt? Over 10,000 employees now, or getting close to.
Yeah, we're about 5,700 employees, and after our acquisition closes before the end of calendar Q2, we'll be pretty close to 10,000.
Yeah. Well, regardless, the region's largest healthcare provider and its largest employer. Matt, you stepped into the role in April 2025 and bring deep expertise in strategic planning, quality improvement, and lean process transformation. And you're leading Freeman through its next phase of growth. So, Matt, you've accomplished a lot of growth even leading up to this episode. I've been looking forward to this discussion. And again, welcome to Leading Rural Healthcare.
Thank you. Yeah, thanks for having me. I've been looking forward to this as well.
So you stepped into the CEO role at Freeman in April 2025. So when you arrived, I mean, what would you said the first two or three priorities were that you focused on?
I think every CEO, regardless of whether you're in a rural or an urban market, the number one thing that I focus on, and I think probably a lot of CEOs focus on, is getting to know the lay of the land, getting to know the team, building relationships, establishing my philosophy on leadership and communication and engagement, and making sure that people know what that philosophy is, and that I'm accessible, and that I view myself as just another member of the team standing shoulder to shoulder as we try to deliver superior healthcare. Building those relationships and assessing talent and making sure that the structure of our leadership team is adequate to meet the needs of the health system. That's priority number one. Priority number two is really learning about the rich culture of the organization, learning about the communities that we serve, the people that we serve. There's a host of ways to do that. Community health needs assessments and community health improvement plans are a great way to dig into that. So I encourage any CEO entering into a market to really dig into those things. Looking at any information that you have on the history of an organization and the history of a community. Joplin, Missouri, sadly was hit by a massive tornado in EF5 plus back in 2011. And then that is, although it's a very sad and upsetting time in the history of Joplin, it's an important thing for an incoming CEO that's new to the area, new to the organization to understand. So that would be another thing, is really understanding the dynamics, not only from a business, a financial, but also from a quality, a patient safety perspective, and then understanding the community and the people. And then finally, I would say understanding your competition, understanding the needs of not only your immediate primary service area, but your secondary primary service area, because strategic development and strategic growth initiatives, they really do need to begin on day one. We've had a very robust M&A plan that we've been working for the last 11 and a half months. And we've had some successes with that. But as anybody who's done M&A work knows, I like to use this analogy with my team here. You throw 100 lines in the water, you might get nibbles on maybe 10 or 15 hooks, and you might actually snag one or two fish. Due diligence is a very important disciplined process, but oftentimes things don't necessarily materialize the way that you think they will until you start to pull back the sheets. So those are a couple areas that I did lean into when I came into this role, and I would encourage other CEOs to do the same as they embark on new territories and new
Yeah.
organizations.
Yeah, we'll build on that. I mean, obviously, Freeman's. I'd encourage you to share what you've learned about their rich history and kind of the humble beginnings, right? I mean, in the um, over 100 years ago, right? But even more so, you talk about coming into as an outsider. Where your predecessor, I think, she had been there for, we'll call it 13 years, but had been with the organization for decades. How do you expedite that again to gain credibility within your organization and develop those partnerships and trust internally as you step into that role and have been there, for almost a year now?
It's a really important question, Brendan, because so Freeman Health System has been around for 100 years. We celebrated the centennial celebration a couple months after I started in the role. And to my knowledge, I am the first CEO, system CEO within the Freeman Health System that has been hired from outside. So there is a lot of history there and frankly, just some challenges that being the first individual, not only from outside of the system to take the helm, but outside of Joplin, outside of Missouri. So, that takes a lot of listening, a lot of understanding. It takes a very humble approach. I don't know all the answers, and I certainly try not to pretend like I do. And so that's really step number one. And I think, as we look at building relationships, it all starts on building trust. And, there are some core tenets that I think are applicable to anybody moving into a leadership role, whether it's a CEO role or not, whether it's urban or rural. And that is, you got to lead by example. You have to do what you say you're going to do. You have to act with honesty and integrity. Oftentimes, this role requires you to make very difficult decisions that people don't necessarily understand. And sometimes they don't agree with. But a lot of folks aren't privy to the same amount of information that I'm privy to. And, sometimes I have to make those decisions that are unpopular, but they're in the best interest of the organization or the community. And once you have a foundation of trust, that becomes a little bit easier to navigate through.
Yeah. Yeah. Well, I mean, again, it takes a while to get integrated. You're an outsider, but the benefit, I imagine, that you're an outsider that brings perspective, right? Not only were you not in that community, not with that system, not in the state. I imagine perspective comes very quickly, right? As you start to form perspective. But I mean, you came from Freeman's one of the region's largest just employers, period, as is what we oftentimes see within rural healthcare. And again, we'll kind of get to it. Freeman's obviously a large system. You serve largely a rural market in the areas in which you serve, but how does leading a locally owned nonprofit system differ from your previous roles heading up organizations, of similar size?
There are some differences for sure. The connectedness to the local community is
Yep.
stronger in a locally owned, locally governed nonprofit health system, but there are a tremendous amount of similarities. I think, health systems across the country, by and large, want to do the same thing, and that is provide access to high quality healthcare to the communities that they serve. And I think Freeman is no different. We have a large competitor in town, Mercy
Yeah.
Health System, that has 52 hospitals. They're largely based in Missouri, but they have hospitals in Arkansas and they have hospitals in Kansas and Oklahoma. And Mercy is comprised of really, really great people that are really smart and talented that want to do the right things for the right reasons as well. Um, Sometimes they have an inherent conflict with being a part of such a large system. Um,
Yep.
Decisions are sometimes made in areas that are very detached from the rural settings that Mercy's operations are operating in, and that can create conflict. And I think that we, by and large, at Freeman Health System, are able to avoid some of that by being boots on the ground and singularly focused on not only this community, but the other communities that our hospitals and our clinics are located in. Um, One thing that helps with that is, I'm a very firm believer in presence. And my executive team and really all of the leadership throughout Freeman Health System are very in tune with that. And, we believe in actually being in the communities. Earlier today, actually, just before our session together, I was at Missouri Southern State University
Hmm.
supporting a charity event that's going to take place there. And tomorrow I'll be back at MSSU for the Wilcoxon Innovation on Health Science, which is an all-day um, uh, conference, if you will.
Yeah.
So, I think there are some differences, and it's probably a benefit to us because we get to focus more intently on the needs and the challenges that our community faces, maybe a little bit more so than those that are spread
Yeah.
out geographically amongst urban, rural, and in multiple states.
Yeah. Well, obviously, Mercy, they face that dilemma again with 52. Again, as a call it a microsystem, right, where you're going to have eight. How do you evaluate, to that end, the health system at this scale? What do you decide to centralize, uh, and then what to standardize, and then what to leave local, right? I mean, because again, to your point, you're trying to meet the needs of each community while operating under the confines of one system. So what do those decisions look like? And feel free to give me an example of a dilemma you've faced even just in this first year.
Yeah. So specific to the acquisition, I'm going to be a little high level and vague as that
Yep.
transaction has not closed yet. Uh, but really, the assessment phase of what to centralize, what to leave local, it really comes down to what what is going to help us to empower local leadership, local physicians, local nurses to provide the best care possible. Um, typically speaking, you have an opportunity to centralize support services, your finance departments, your revenue cycle, those types of things, because you can be sitting largely anywhere in order to do many of the components of those functions. And if you centralize those things, you can get economies of scale
Right.
and you can produce the same result at a lower cost and thus help to lift up the rest of the system by having more money to reinvest into other things like new technology, wages, et cetera. Um, but one thing that I think a lot of health systems maybe lose focus of as they grow is maintaining decision rights and authority in local teams. So as Freeman moves into a more market structure, one thing that we are going to be mindful of, and that we've been trying to be mindful of since I moved into this role, and I'll talk a little bit about some of the organization changes that I implemented shortly after starting
Yeah.
here. Um, are really empowering our C-suite leaders, our vice presidents, our directors to be owners of their areas, to really take that ownership, make those decisions. If you fail, that's okay. It's okay to fail. Um, it's what we do after that failure that makes the biggest difference. Do we learn from it and move forward in a progressive way, or do we continually make the same failures over and over again? Um, and that's really where we want to get as a leadership team. We want to make sure that those folks that are leading a single hospital or leading a region, that they have the decision rights and the authority to make decisions, to move quickly, to be nimble, to fail if it comes to that, and then to learn from it and move forward.
Yeah.
Um, you know, putting this kind of an example you'd asked for, when I first started, I realized that the leadership team wasn't necessarily aligned in a way that we needed the leadership team, or designed rather, in a way that we needed the leadership team to be designed in order to facilitate the future of Freeman that I had a vision for and that others had a vision for. And so we executed a reorganization of the senior leadership team within the first 90 days of me being here. And although that was a challenge, there were some individuals that weren't necessarily in the right seats of the bus. There were some
Yeah.
individuals that um, uh, maybe weren't a good cultural fit for where the organization has been and where the organization was going. And there were some people on the team that really needed to be elevated up and empowered to do more. Um, and so we went through a discernment process and we realigned the leadership team, recruited in new leaders, and really established a senior leadership team that we felt was going to provide a chassis to bring us into the future. Um, Two quick examples: we had one individual that was the chief operating officer of Ozark Center. Ozark Center is 600 employees strong, CCBHC, one of the largest in the state of Missouri. It's wholly owned by Freeman Health System. Um, that individual is a COO, had to kind of really defer to the CEO and to others to implement change and make decisions. Well, we quickly made that individual, Vicki Meisler, CEO. Titles do matter. Made her a CEO and restored some authority and autonomy that I think she needed in her role.
Yeah. Oh, that's fantastic. In fact, I'd love for you to talk about Ozark. You know, when I think about Freeman and that integration of that facility, as I understand it, or that small system, right? I mean, that was mid 90s, right? Bringing in mental health care into a system where, again, when I think 20 years up till now, thinking forward, how does that integration really play into the rural markets in which you serve? Where, as you know, right? I mean, this it's behavioral mental health access is hard to come by.
Yeah, yeah, no doubt about it. And in rural America, um, behavioral health is even more of a challenge because there are less psychiatrists, there are less psychologists, there are fewer resources around to tap into. And so we have higher than national average suicide rates, we have higher than national average substance abuse rates. So investing in behavioral health is incredibly important. It's something that's been a core to the ethos of Freeman Health System for a very long time. Ozark Center joined Freeman Health System a couple decades ago, but Ozark Center has been around for over 50 years.
Yeah.
And so it's been continuing to grow and proliferate services throughout the communities that we serve. Um, we have just recently embarked upon, over the last really 11 months, embarked upon a one Freeman philosophy. Ozark Center, although it's been from form and function been a part of Freeman Health System, we have very much operated as if we were two separate units. And I feel like that is a missed opportunity. And I know a lot of others do too. That isn't just me. So we've been working towards fully integrating the two, um, strengthening Ozark Center while embracing a one Freeman philosophy. And I got to tell you, it's been fantastic. It's elevated those colleagues from a salary and benefit perspective. It's provided us an opportunity to have even more rich support services for Ozark Center. And it's allowed us to invest in pursuing other innovative technologies and innovative treatment paths for those that are suffering from mental health
Wow.
challenges.
Wow. Well, I'm sure the outcomes that are, I mean, the positive outcomes and impact that's going to have, you probably haven't even seen to the full extent when you talk about that integration. I mean, you've led strategic planning and organizational restructuring over the past year. You've hit on a couple of instances where, with leadership and with Ozark Center, you've identified, a need for change. But how did you, taking a step back, approach the need for change, again, in this first initial year? How did you approach it without destabilizing the organization? And I'd follow that up with how do you find key stakeholders to give you a feedback loop so early on to make sure you're staying grounded, right, with these decisions that you're making?
I think part of it is being vulnerable and really asking, soliciting for feedback. Creating psychological safety amongst your senior team and then hopefully trickling that down throughout the organization can have an extremely profound effect on people's willingness to provide feedback, whether it's positive, negative, constructive. Um, you know, so I've always tried to be very intentional about that. Um, Another thing is really doing things collaboratively and bringing people along with you. When I started here, I had asked one of our senior leaders if I could get a copy of the strategic plan. And it, spoiler alert, we didn't have a strategic plan, and it had been a little while since we had had a strategic plan. And so, that was kind of a gimme, right? That was kind of an easy lob pass for me. Um, so we embarked upon creating a 5-year comprehensive strategic plan for the organization. It took about 7 months. We had board engagement, we had multidisciplinary teams. The end product that we rolled out in November is actually it's something that I'm very proud of. There were a lot of hands that took part in that, and if anybody's interested, you can find a public-facing version of the strategic plan on our website at freemanhealth.com. But it's really centered around 5 points of purpose: excellence in care. We want to provide exceptional care to our patients. I mean, for all those patients that their condition allows, we want them to leave our doors, whether that's in a clinic or in the hospital, in a better condition than they arrived. We want the experience to be exceptional, not only for the patients, but for their families, their caregivers. The second point of purpose is around people first. We want to make sure that we're really recognizing and rewarding the unique contributions of all of our colleagues across the continuum of care. That's monetary, that's non-monetary. Some of the things that we've done, we're working on implementing career ladders, not just in nursing, but for technical positions as well across the enterprise. We're looking at tuition reimbursement and doing a full comprehensive evaluation of benefits. We're actually going to the board this afternoon with our recommendations on wage increases for our colleagues across the enterprise going into the next fiscal year. And then finally, we're implementing a process to really calibrate colleague engagement. We're implementing a colleague engagement survey, which will actually kick off here in just a couple of weeks. And it is a novel process for this health system. So it's something completely new, but it's a tool that will help us to get better and better. The third point of purpose is strategic growth and development. And that's really that M&A activity that I had talked to you about earlier.
100 poles out in the water, right?
There you go. There you go. And we've had some successes. We've acquired a large building here in town that we're going to infill with some medical practices. We've acquired the AT&T building where we're establishing our Epic hub. We've acquired Northwest Health we're working towards acquiring Northwest Health out of Northwest Arkansas, and a couple of other things. The fourth one is community engagement. Freeman's always been really good about engaging with the community and being present, but we all felt collectively that we could do even a little bit better. So it's really centering an entire strategic plan around time, treasure, and talent. And how do we lean into that space with intentionality? And then finally, it's operational integrity. We want to be good stewards of the resources that have been bestowed upon us. We want to eliminate waste where possible and enhance the experience and the workflow wherever we see an opportunity. We're rolling out lean process improvement throughout the enterprise right now, and that will help us with that, engaging frontline staff and everyone else in not only the opportunity identification, but then also the experiment creation. But ultimately, our goal is to be able to provide frictionless access to the healthcare that we provide. We have some phenomenal physicians here, and I really want the people in our communities that we serve to have access to them.
Yeah. Well, you talk about eliminating waste, and I've got to ask you because it's got to be something you're passionate about. That you bring this deep lean. You mentioned it just now, Lean Six Sigma training and patient safety expertise to the table. When you think about embedding that process improvement into Freeman's culture rather than treating it as a project, what comes to mind, and what goes into your actions that make it, again, make it more of a cultural change rather than, hey, here's this project. We're,
Yeah.
going to make all these changes at once.
You know, you touched on the most important aspect of this culture. Um, Lean process improvement and a lot of the other things that I've talked about here, they're not a one and done. You're never done
Yeah.
with process improvement. You never get to the end, right? I
No.
had a boss a while ago. She's still a mentor of mine. Fantastic woman, incredible operator. Um, and she used to always just ask me very humbly all the time, no matter how successful I was at something, I'd come to her and I'd say, Trina, we did this, we had this success, and this was the end result. It's better than we even had expected. Wow, that's really incredible. Please give all the thanks and praise to your team. That's incredible. Now, Matt, I have a question for you. I said, what's that, Trina? What does a little bit better look like? And and that's really the
Yeah.
philosophy. I think, again, we all want the same thing. We all want to just provide exceptional care. And that journey for excellence it's never done. You never get there.
Yeah. What's the saying? How can I get 1% better every
Yeah.
single day? And as the landscape shifts beneath your feet, as it does in healthcare, right? As it does with new advent of technology, changes in laws, regulations. I mean, uh, it's not hard to see that that point is valid, right? You're always going to have to improve, and
Totally.
that might look different than what it looked like yesterday or last year or last month. So, I mean, give me an example of like, so back to the lean initiatives. Give me an example of an initiative at Freeman that you feel like has had a meaningful impact or that's going to have a meaningful impact either clinically or operationally, whichever comes to mind first.
Yeah. I'll give you one that I'm really proud of. Our system vice president and chief nursing officer, Janae Kennedy, she's really exceptional. And I don't think that she had necessarily been empowered the way that she could have been in the past, and it's of no one's fault. It's just it happens. But she has really stepped into this elevated space with intentionality, and it is quite impressive to see. Well, she's leading the lean process improvement across the enterprise, and she's already activated several teams, PI teams, process improvement teams. And one of those teams, which is multidisciplinary, including physicians, nurses, leaders, techs, EVS, food service. I mean, you name it, right? All the ancillaries, radiology, lab, pharmacy. Um, when they're looking at a lot of things to enhance the workflow in the emergency department, and they've been at it for about 8 months now. When I started here in April, I'm a little ashamed to say that our left without being seen on average was about 10% in our main flagship hospital. That left without being seen now is right around 1.5%.
Wow.
And it has been 1.5% for about 4 months. So just
Congratulations.
think about that incredible movement that
Yeah.
Janae and the process improvement team has been able to effectuate. I mean, that is incredible. And there are a number of other things that they had to work on in order to get to that end result. And the work isn't done. That PI team continues to meet. They continue to look at, in fact, they just implemented, I don't know exactly what the job title is. It's a new role, but it's worth the investment for us. Um, is It's almost like a traffic control nurse that can
Yeah.
help to manage the EMS traffic and help to manage the bed capacity within the emergency department so we can get patients bedded quicker, we can get rooms turned over quicker, and we can have that throughput working as efficiently as possible in the ED. So that's one example. I could probably sit here and chat for an hour about this, but
Yeah.
the teams have really embraced this and they're producing really, really good results.
Yeah. Well, no, I love to hear, especially when we talk about this all came from a master level strategic plan, and embedded within that was, these initiatives that are trickling down to make meaningful impact, which is just cool to say. I mean, when you think about how you connect, just talking quality improvement, right? So
Yeah.
that could be operationally, clinically, in the ER without being seen. That was obviously, probably a mix of both, right? But quality
Hmm.
improvement uh, to financial performance, so that it's not seen as extra work. How do you connect the two?
Um, I don't, most of the time this is true. I had a mentor many years ago, and another just exceptionally smart woman. She used to always tell me, you focus on your people, you focus on quality, and you focus on access, and the finances will come.
Mm.
You don't even really need to talk about finances all that often. Yes, you need to watch it, and yes, you need to be aware of current and trended performance, because if there's something that's unexpected that pops in, you have to be able to address it in real time. But the reality is if you handle the fundamentals, the finances will follow. And I truly believe that. So quality is a really good one. So one of the most important things we can do is focus on quality, I think. We When I started in my role at Freeman West, our CMS star rating, our overall star rating, unfortunately, is a 1-star hospital, Freeman West, our flagship here in Joplin. We are now a 2-star hospital. We're on track to be a 3-star hospital in the spring of next year. And everything is trending in that direction. We probably would have hit 3 stars this year, but we're doing a full enterprise-wide EHR integration into Epic in October, and our current system doesn't meet some of the requirements that
Ah,
that we needed to. It's a legacy Meditech system. So anyway, um, but we've set a goal to be at 4 stars in 4 years. So I've been here 1 year. We have 3 years to go to get to 4 stars. That is, I think, all of us kind of putting our money where our mouth is, right? We are demonstrating through words and actions that quality is a fundamental, if not the most important thing we do, one of the most
yeah.
important things we do. And we're all driving to that end goal and that end result.
Yeah. You talk about all driving to that end goal, that end result. I mean, sounds great, right? I mean, let's talk about the flip side of that coin. I mean, typically when you're implementing all of this, what resistance do you or leaders um, typically encounter when implementing lean in healthcare, and how do you overcome it?
Yeah. Change management is a challenge. It's ever present, the need for good, solid change management. I think the best way to overcome the resistance that's inherent with change is communication and its presence, honestly. And, I bet if you were to round throughout Freeman right now, folks would say we don't communicate enough. And they would say that our communication probably isn't targeted enough, that we aren't present enough. And I don't necessarily, I don't think that that's a bad thing. I think what that means is, much like how lean process improvement, what does a little bit better look like? We should always be striving to do more. Yes, we're conscious of it. Yes, we're trying to do the best that we can, but sure, we can almost certainly do better. And, providing those feedback loops to allow for that feedback to flow back to us so we can try to do better is really, really important for us. But, you know, those are the kind of fundamental things that I think really help to drive change in a positive direction. I Early in my career at Sutter Health, I was indoctrinated on ADKAR, ADKAR, which is a change management philosophy. Many of us, through academics, learned about Porter's change model and things like that. I really like the ADKAR model, and I won't bore the listeners with what ADKAR means or why I like it, but check it out if you get a chance, because it's fairly basic and it talks a lot about awareness and knowledge and creating desire. And when folks have desire, it motivates them to help to facilitate that change. And although some days get more challenging than others, and sometimes we feel just completely exhausted and beaten down by some of this stuff. When we get those wins, when we see some of the results come to fruition, boy, does it feel good.
Yeah. Well, I mean, I'm sure it does. And I mean, all of that is reliance on the confidence that you have in making your decisions, which is the CEO, you do every day, right? Micro decisions, large decisions. So I want to kind of go back to that feedback loop
Yeah.
you've alluded to a couple of times. Tell me what the feedback loop you use, again, that helps you decide and give you a barometer for decisions. What does that look like in practice? Is that committee? Is that a cabinet that you have? Surveys? I mean, what kind of goes into that to help give you the confidence you need to make the decisions that you make?
So we're building the plane while flying it right now. Um, I meet with my executive leadership team once a week for 2 hours. So we have an ELT meeting in the afternoon once a week. I have one-on-ones with every one of my direct reports once every 2 weeks. Um, and then one thing that my team would probably tell you if you asked is, I text people at 4 in the morning and I text people at 10 p.m. And it's not, I'm not like expecting a response all the time. It's more because thoughts pop in my head and,
Right.
I want to get them out. But I make myself as available as possible to my team. And I'm always asking for feedback. What can we do a little bit more of? What can we stop doing? What can we start doing that we're not doing? So that's one piece. A second piece is we've implemented, last year, we implemented regular quarterly town halls. So
Mm.
that's a way to really directly engage with our colleagues. We're starting this year an annual report that this will be the first annual report that we've had since the 80s at Freeman Health System. And that will hopefully get
Mm.
published here in the next week or so for 2025. We're starting a monthly newsletter that I'll have a little portion at the top. We'll talk about what we've achieved over the last month and then what lies ahead. Um, we try to have executive leadership present at most of our physician leadership meetings, including med exec committee,
Mm.
including service line director meetings as well.
Yep.
And then we do a biannual. In fact, we have one coming up in about 6 weeks, all med staff meeting where it's like a town hall forum where we feed some food and or provide some food and we go through a series of presentations and then I just directly solicit feedback from the providers. It's Q&A, nothing's off limits, and provide folks an opportunity to ask or even express grievances that they have on their mind. So we
Yeah.
try to provide as many avenues as possible. Could we do more? Absolutely. But we're unfortunately there are limits to how much time there is in a day and bandwidth. One other thing I should mention, we've implemented, and things have been really stressed the last 6 months as we've been working through this acquisition. But we've implemented a regular rounding format for all of the executive leaders to be rounding on the units, not only in the acute settings but in the ambulatory settings. We're as things kind of calm down with the acquisition, we'll be kind of redoubling our efforts in ensuring that we're adhering to that rounding schedule. And so that's just another mechanism. So that way we can hit feedback from physicians, feedback from leaders, feedback from executives, feedback from frontline staff. And then finally, I guess I should mention, I'm very engaged with the community. So I
Mm.
speak in the last 6 months, I've spoken at the Seroptimus Club, the
Yep.
Kiwanis Club, and several other venues throughout Joplin and surrounding communities.
Yeah. Well, I mean, you're certainly invested. It sounds like, of course, invested in the community, which it being new, you have to be, right? For a number of different reasons. You're invested in your clinicians, your staff, getting that feedback in hopefully real time, right? And you even alluded to earlier, you're investing in human capital, right? I
Yeah.
mean, that could be broad, but you're talking salary schedules, overhauling benefits, et cetera. I mean, you've spoken about that. What does, at least just the human capital piece, right? Just transitioning to that. What does that investment look like in practice at Freeman right now and the initiatives that you have going on?
Um,
That you can maybe share. Right.
yeah.
Right.
So there are some that I can't share because it hasn't been fully. The budget, which I have right here next to me, is
Yeah.
this is the finalized fiscal year 27 budget. Our budget year runs from April 1st through March 31st. Has not been fully approved by the board yet. So I have to be a little careful with what I share
Sure.
from that perspective. Um, but a couple kind of concrete examples from a human capital management perspective. We implemented a couple months ago a career ladder in sterile processing.
Okay.
Sterile processing is typically an area that a lot of folks in sterile processing don't just transition to becoming a nurse. They're in that field for a reason. They're passionate about it. They really like what they do, and so they shouldn't be limited to remaining in the same role in perpetuity for the rest of their career. What we should offer them is an opportunity to earn additional certifications in sterile processing, become even better at their role,
Mhm.
become true subject matter experts, and advance to a sterile processing tech 2, sterile processing tech 3. That has monetary incentive, but it also allows for them to truly become masters in their domain. So that's one really concrete example of something that we've already implemented, and we're going to continue to do that throughout the enterprise.
Yeah. Certification advancement. You already alluded to adding, if I heard you correctly, tuition reimbursement programs. Sounds like you're really making some investments where, uh, that maybe you've needed to keep up with the trend and be a leading employer as it relates to benefits. So, I mean, with nearly kind of talking, staying on your employee base with over, call it 5,000 employees, a lot of change going on. How do you keep frontline staff engaged during all this change and likely growth?
Um, that is a challenge. That is a challenge. I think that I think demonstrating that we're making decisions, we're doing everything in our effort to make the right decisions at the right time for the right reasons. Um, Sometimes those decisions are a little challenging. Introducing Epic enterprise wide. Currently in our inpatient, we use Meditech, and it's a very old sunset version of Meditech. Um, and then in the outpatient, we use Athena. Really, it's GE Centricity, which is a old version of. It was actually bought by Athena. So we are converting enterprise wide to Epic. Now that requires a complete overhaul of how we do things from a workflow perspective, a documentation perspective. Um, it's the right thing to do, but that doesn't mean that it's not exhausting and challenging and creates its own hurdles from a change management perspective. So, I think it's reminding people of the why. It's instilling that and reinforcing that trust that folks have in us in our decision making. And it's really just asking them, come along with us on this journey. And, some people might not want to. Some people might want to exercise their ability to go elsewhere, and that's okay too. We want to treat everyone with dignity and respect, regardless of what their decisions are. And if they don't feel like they can come along with the journey, that's okay, and we can help them to get positioned somewhere else. We can help them transition to something else,
Yeah.
and we can do that with dignity and respect, and we can do that where we all remain friends in the end, and it can be a very healthy and positive thing.
Yeah. Well, I mean, you hit on what I feel like is key in this whole process, and that's communication of the why. And
Yeah.
I would even take that a step further to say that communication probably looks different at varying levels within the organization, right? I mean, in terms of who you're speaking to, the department, et cetera. I mean, so if you want to comment on that, I'd welcome how you approach that communication tactfully or
Yeah.
tactically.
So I had a mentor about 10 years ago, 12 years ago. And he used to always say, you got to start with the WIFM. What's in it for me? And it's not because people are bad people, but people want to know how they're going to be impacted, right? That is natural. That is, we're providers for our families, we're providers for ourselves. It is important to understand how things are going to personally impact me as an individual. So, trying to draft communications that take a kind of global stab at a WIFM for a group of people, physicians, for example. How is this going to impact me as a physician? How is this going to impact me as a senior leader? How is this going to impact me as a phlebotomist? Um, Trying to be as catered to the WIFM of specific groups is really, really helpful. And then I think secondarily to that is providing an open door policy. If you have questions, a lot of our physicians, and many of them don't use it anymore as frequently as they used to, but they have my cell phone. They can text me, they can call me. I'm available to them whenever. Same with our leaders and our frontline staff. Um, but it's providing that open door policy to where if you do have a question, don't sit there and stew on it for 6 months and create your own narrative. Just ask the question. And maybe
Right.
we didn't think of it. Maybe it's a gap in our process. Maybe if you have that question or that concern, 40 other people have that same question and concern, and it's an opportunity for us to provide clarification more broadly.
Yeah. Yeah, no, I love it. I mean, you've got to find those channels. I mean, you guys, I do want to, I want to shift gears a little bit. You talk about kind of the M&A activity going on. You guys have over 90, what do you call it, 90 specialty services. You serve patients across 3 states now, maybe a little more. How do you determine internally, so outside of M&A, but just internally, which service lines you already have, which ones you're going to grow? And then which you might reevaluate.
So there are multiple avenues to try to discern that question. And that one is a very complex conundrum. So one, we always want to look at what need are we fulfilling? Does the community have a need? And you can find that by looking at community health needs assessments.
Sure.
You can find that by looking at claims data to identify supply and demand gaps, i.e., you have a ton of rheumatology need, but you got no rheumatologists,
Right.
for example. So I think that's one. What does the community need? What gaps exist, and can we safely and um, sustainably provide a solution to that gap? There are some things that we won't be able to provide a solution to. Um, you know, we probably in Joplin, Missouri, are not going to be a transplant center for heart transplants. There isn't enough volume for that, and it would be cost prohibitive for us to do that. There also, when you don't have enough volume and you don't have enough repetitions, it can be more dangerous
Safety.
for
Yep.
physicians to do that because they don't have the same level of training. So, you take all of that into account, and that really sets the stage. That's how you identify where you want to lean in and where you might want to pull back a little bit. I would be remiss if I didn't say other challenges that exist that you really do need to be mindful of. Go back to the sustainability piece. Um, can you staff it? Can you staff it with
Just
colleagues?
gonna
Can you
ask.
staff right? Can you staff it with physicians? Um, do you have the space required to do certain things? Um, are you in a CON state? Missouri requires a certificate of need for various things.
Mm,
And do you have a good case for going to the CON committee and arguing that you actually need something? So it's multifaceted, but and it requires a ton of homework to actually figure out where you lean in, where you pull back. Um, the due diligence as you do these assessments cannot be understated. And it's really important. If I could just kind of implore every CEO or everybody going into a leadership role, whether you're rural or urban, and it's probably more poignant when you're rural because resources are more scant. Um, just be very methodical. I would say measure twice, cut once, because some of these things, particularly if you're on a very tight shoestring budget, could be they could be pretty damning for your organization. They could result in you having to make some uncomfortable decisions around possibly looking for an acquisition partner, or uh,
Sure.
even more drastic than that, closing down hospitals, et cetera.
Yeah. Well, I mean, it's always you know, that's always a conundrum. Even just having the conversations I've had, clients, prospects, even through the handful of conversations I've had through this podcast so far,
Yeah.
that comes up. And usually at the top of that list, when those decisions, again, those conversations I've had around new service lines, sustaining service lines, growth, shrinking, et cetera, staffing's always at the top of the list. It seems
Yeah.
like, regardless, hey, we have the investment, we're ready to go. Um, you know, finding the talent is tough, specifically when I'm talking about rural. And so I'm curious again with you guys, having Freeman having a rural footprint. When you think about, we'll just stay on physician recruitment right now, not talk about nursing, mid levels, et cetera. But what's been a guiding philosophy, and what's been a challenge that you guys feel like you've met, with maybe either innovation or just brought something new to the table to help get through what everyone's dealing with, which is how do we hire, recruit, and retain these talented individuals?
Um, Leveraging technology has been something that we've done well in the telemedicine space. So we have Renee Denton, who is our CEO of Rural Hospitals. She also is the chief executive responsible for our school telemedicine program, which serves 25,000 students and school staff across Missouri, largely Southwest Missouri. Um, that is essentially putting technology into a school where if a student complains of being sick, they can go to the nurse's office or to the administrative office. That individual who does not need to be like that works there, who does not need to be a clinician, can establish the connection between this robot apparatus, the patient, the child, and they can even teleconference in the parent.
Wow.
um, the physician or the nurse practitioner on the other end of that robot can assess the patient and even provide guidance, direction, and even prescribe things that might be helpful for that patient. So the patient can remain in school, so the parent can remain at work, and so they can kind of manage the patient's symptoms that way in a less disruptive way, reducing the economic impact that it has on the parents as well as on the school. So that's one thing that we've done to help meet the challenges in this rural setting. But we're always looking for other ways to meet the unique challenges that we face in, frankly, rural America.
Yeah. Well, I mean, it's ever changing, and it's only getting more difficult, right? I mean, how do you, when we talk about, rural, well, whether it be expansion, the things you guys have going on, how do you balance the regional expansion, um, you know, all the things you're talking about on the M&A front, with maintaining strong local community trust in the areas in which you already serve? Meaning, it's said another way, right? Do you still care about me, or are you focused on what's going on over there?
Yeah. So we have a philosophy in my family at home, and it is you can do almost anything you want as long as you're willing to work hard enough for it. And this is something that we are committed to working hard enough for.
Yep.
That 5 year strategic plan, um, that didn't entail the acquisition of the Northwest Health System out of Northwest Arkansas. We were in kind of earlier talks at that time. We hadn't even progressed to a letter of intent as we were kind of going through that. And so um, that strategic plan is intended to guide us and focus us for the next 5 years here in Joplin, here in our current legacy system
Yep.
that we are so passionate about. The quality improvements I mentioned, that is here. That's in our legacy system. And
Yeah.
we have plans and process improvement efforts that are specifically focused in our legacy system. This, when we grow, and maybe Northwest Health, maybe a couple of years from now, we have an opportunity to do something different and grow in different ways as well. Um, that doesn't mean that we shift focus or lose focus. It means that we are expanding our base and bringing that same level of execution and compassion to other communities that hopefully can realize the benefits of that. Northwest Health System, as I mentioned earlier, with autonomy and authority, is going to have a robust and high quality leadership team that is going to lead the charge on a day-to-day basis. And we as a health system, as a health system executive team, we're here to support that. My job as a CEO, and I think the rest of my leadership team feels similarly, I'm really at the bottom of the pyramid. I'm not at the top, I'm at the bottom. I'm here to support people, lift them up, eliminate barriers, and help to allow for everyone to be successful, because when they're successful, our patients are going to be successful in the care that they're seeking from us.
Yeah. No, it's obvious you're certainly going to, continue to invest locally. I guess my follow-up to that is just, is there a communication effort that that allows you to give that perception off, control the narrative with the communities that you serve, right? So to
Mhm.
that end, right, you're going to balance that. In fact, your strategic plan, as you mentioned or alluded to, had really nothing to do with that. That wasn't
Yeah,
included in it, right?
yeah.
So how do you just from communicating with the public, which we haven't really touched on, what goes into some of those efforts, as you approach this acquisition, but even just in general?
It's a really, really important question. Um, so one, internally, I had mentioned some of the things that we're doing from a communications perspective, including monthly updates and things like that. What I didn't mention earlier is we're going to start, I don't know if it's weekly or biweekly, um, communications, both internally to our current system and to Northwest Health, um, focus specifically on the acquisition and the integration work. And that will come out to all colleagues. That'll come out to our boards. That will, really help to educate everybody as we continue to progress through the process and provide updates on, key milestones and things that we're doing as it regards to the integration work and the acquisition. And I think externally, we just need to be really mindful and thoughtful on how we communicate with the public, both from a frequency perspective as well as a content perspective. We have some really strong marketing and communications folks within the Freeman Health System, but we're also partnering with a consulting firm, Level Communications, to help us with that communication strategy, both internally and externally as well. And they've already provided a wealth of knowledge, and they're going to be helping to guide and shape our communications process as we move forward throughout this integration and then post go live.
Yeah. Well, that's fantastic. I mean, again, you've got a process in place. I just talking to you this past almost what it's been almost an hour. You're nothing if you don't have a process in place, and you certainly have that just based on the feedback I'm getting. But um, question for you. So Freeman, we talked about Ozark Center, which of course is the region's largest behavioral health provider. I want to touch back on that because it's so important to the fabric of rural health, and you've talked about how you're reaching kids in schools, and that's fantastic. You even alluded to earlier how as we know in rural setting, there's fundamental reasons why behavioral health is an issue from an access standpoint, but also just in rural, when you think of rural men, right? I mean, going out to seek the care in general. There's a difference in rural communities versus what you might typically see stats show us in an urban community, right? So how do you integrate behavioral health into a broader health system strategy? You talked about, hey, we're starting to integrate from these being two separate entities or being treated as two separately
Mhm.
commonly held entities. What does that integration look like at Freeman?
So we've been very fortunate here because the CEO of Ozark Center, who I mentioned earlier, Vicki Meisler,
Yep.
she's been developing and working under the strategic plan construct for well over a decade. Um, and so she actually has a very mature process. When As we move to the one Freeman philosophy that we're all intent on driving forward with, that is not to say that Ozark Center doesn't maintain its identity or
Yeah.
its priorities. Rather, we're going, and we already have, incorporate Ozark Center and Ozark Center specific initiatives, behavioral health specific initiatives, into the overall Freeman Health System strategic plan. Um, it's not a either or, it's a yes and. And we've been trying to be very mindful of that. I'll touch back on the other thing that you had mentioned, and that's the stigma of seeking care.
Yep.
Um, you know, I don't have a perfect solution for that, and I don't think anyone really does, or the problem wouldn't still exist. Part of what I try to talk about and display to individuals throughout the community who I speak to either on a one-on-one basis or in a group setting is that by and large, this is a no judgment zone. I mean, we're here to provide healthcare. We're not here to judge you or your activities or who you've been or who you are or what family you come from or your socioeconomic status. Frankly, if that informs the healthcare that we provide you, great. We want to know about it. But if it doesn't and it's irrelevant, then we don't, we don't care. It's not something that we're ever going to hold
Yeah.
against folks. And the other thing is, being vulnerable and being honest. I personally, my wife is an only child. Her father struggled mightily with mental health issues, and he passed away a couple years ago. But it was unless you've seen it, unless you've experienced it, it's very hard to understand what that's like. And although I think on some level he knew that he was struggling mightily, he refused to seek care.
Yeah.
Um, and it probably led to an earlier um, death than otherwise he might have experienced. So, I think sharing those experiences and sharing the fact that we're all human and we come at this from a human-centered approach is very important. I want people to feel welcomed, and I want people to feel like this is a safe place for them to seek care, and
Yeah.
that they're not going to be judged by seeking care. Rather, we're going to lift them up. We're going to do everything in our power to make them well. And that's mind, body, and spirit.
Yep. You talk about the stigma. I mean, that's a great explanation of kind of how you identify the need. When I think about, the stigma and I think about patients that seek services in a primary care setting or other specialties, right? Do you feel like this is rather not a rural health question, but just in general, we are doing a good job asking the right questions in other settings that might help us identify that there is a need, a behavioral health need here that we can help with and kind of create that continuum of care. We talk about that integration. Maybe that already existed before, but just trying the identification process, right?
Mhm.
Um, is that something that's improving? Is that something that is targeted as an initiative to try and loop mental health, behavioral health services into the fold?
I think so. I think we're trying to do a better job as a society and as a culture. We ask now social determinants of health questions um, pretty ubiquitously as folks are seeking care, whether that's in primary care or even specialty care. We even ask those social determinants of health questions when folks get admitted into the hospital. Um, and I think that's a good step in the right direction. We also ask about mental health things such as suicidal ideation
Yep.
when folks are in clinics or when they're in the hospitals. Um, Part of the challenge I think that rural healthcare in general struggles with is what do you do with that information
Right.
once you know that it's a problem? If you have a per capita supply of psychiatrists or even licensed psychologists at 1/50th of what you'd find in an urban area, it's difficult. What do you do with those patients? And so that piece, I don't think we've figured out. Now, telepsychiatry and other telehealth medicine approaches, I think, have helped quite a bit. But I think we can do a little bit better job, particularly in rural America, at providing more avenues to
Yeah.
seek care and really receive that care.
Yeah. Well, I know that's something that's expanding by the weeks and months as rural providers and, quite frankly, forward-thinking behavioral health providers figure out how to penetrate how to penetrate that market.
Yeah.
I want to shift gears. We haven't talked a whole lot about economic impact, but you guys, we established you're the region's largest employer. I mean, how do you think about Freeman's role in the broader economic and community development landscape there? Maybe predominantly in Joplin, but in the communities in which you have a presence.
Yeah. It all centers around our mission. And I think our mission is it's broader than the care delivered in the four walls of a hospital. Our mission is to be good stewards of the resources that have been bestowed upon us so we can have a sustainable health system that can be here in perpetuity to meet the needs of our community. I had mentioned one of our five points of purpose is community engagement. Part of that is engaging in the community. Part of that is doing, the Stop the Bleed campaigns where we're going out and we're educating people. Part of it is, providing the defibrillators to high schools and middle schools to ensure that if a athlete or a coach or anybody in the stands goes down with a cardiac event, we have the resources available there to bring them back to life. Um, Part of it is reinvesting in the community when we have opportunities to um, cater events or to provide awards, non-monetary awards to our colleagues that we're utilizing local vendors to the extent that we can. There's a lot that goes into it, but it is something that we think about constantly. And I think Freeman has really led the way in their approach to being good members of the community. Um, you had mentioned what we were discussing rather earlier on in the call about the difference between a locally owned, locally governed health system and a large conglomerate based out of another state. And although there are ways, if you're really intentional about it, for you to overcome this, in fact, I think Sutter Health is a really good example of a health system that overcomes this well, and they
Yeah.
invest in the local communities that they have presence. Um, but you know, we try our hardest to, whenever possible, to reinvest back in this community, our surrounding communities, and uplift, those that are in need, whether it's specifically medical or it's socioeconomic or it's something else, educational. We want to be here as a partner that can be relied upon to, really be intentional about leaning into that space.
Yeah. Well, again, you talk about having Sutter Health and some of these other systems having success with it when they're not domiciled in that market. But again, it just goes along with your mission statement. You don't have to look very far, right? You don't have other stakeholders involved that might steer you in a different direction. So you inherently, as long as it's part of your mission statement, can reinvest back in. So
Yeah.
looking ahead 5 years, what does success look like for Freeman Health? You've got a lot going on, a lot of momentum. You're new in the role, a lot of changes going on. Uh, do you know what that looks like? And what would you say once you've reached there? Hey, we've sustained success.
Yeah. I think it is achieving a sustainable, unified health system platform across Northwest Arkansas, Southwest Missouri, Southeast Kansas, Northeast Oklahoma. It's having a strong, viable, and engaged workforce. It's being known as being good partners and good stewards in the community. And that's in all the communities that we serve, not just Joplin. Um, and having, to the extent possible, frictionless access for our patients to receive care from our providers. Um, that to me says success. I think you achieve all of that. Oh, and I should also mention, top decile in quality across our
Mm.
entire organization, our entire enterprise. We achieve all of that, and the finances will come along. We won't have to worry about focusing so intently on the finances. Those will follow.
Yeah. Well, Matt, I've enjoyed this conversation. I've really enjoyed the time you've spent with us. I want to leave you with one question I try to leave all of our leaders with. What's one mindset shift you believe that rural health, specifically rural health care leadership, needs right now, and what's one action that can be taken this month?
Um, One mindset shift I would say is I think rural healthcare, um, to the extent possible, we need to be intentional about seeking out um, symbiotic and mutually beneficial partnerships. That's not seeking out someone to acquire us. That's not what I mean by that. That's seeking out those partnerships that can allow for us to realize economies of scale in some of the services that we provide. And I'm going to have a secondary to that, and that is we can't be all things to all people. And on the tight budgets that we have, and sometimes in very small population bases that we serve, we need to be very mindful about where we fit in the care continuum and how can we be good ambassadors of health to our community. And sometimes that means establishing really strong partnerships and referral patterns to other hospitals that might be able to provide complementary services that we either cannot sustainably provide or we just don't have the capability to provide.
Yeah. Well, that's meaningful insight. In fact, this whole conversation has been extremely insightful, Matt. I appreciate you taking the time. And again, you're just getting started. So
Yeah.
I can't wait to see how this all unfolds and it really, truthfully, the impact that a lot of the things you're bringing that, again, to your point earlier, trickle up to the rest of the organization. What it's going to do for the communities in which you serve. So thanks again, Matt. Appreciate you being on the podcast. This was a great conversation.
Thanks, Brennan. I appreciate it.